my name is Cody Leslie. My student ID is 3610172. I'm taking my surgical assistant class this semester, and this is my demonstration video. When our patients get here, we have their check-in and admission forms here. It has their owner's information with their name, address, and phone number, as well as the patient's information. We have Zach here. He is a canine. His breed is a basset hound. His color is tricolor. He has his date of birth, his age, his sex and reproductive status, and his rabies tag number, and his last weight that we'd recorded in our system, as well as a place for his TPR and any of his vaccine information, and if he had any known diseases or anything would also be on this paper. For this is Zach's medical records in our system here. We have anytime he has been seen for an exam, any tests or vaccines he has ever received or been ran here, and the results. In his dashboard here, you will have all of his information, his microchip number, his age, sex, everything here, as long with his weight and all of his vaccines. This is our release forms and consent forms, but so on here we have the owner name, the pet's name, the weight, and the age of the pet. We have on here what they are coming in for today. Zach is coming in to be neutered and to check some bugs that he has on his chest. On here, it's just acknowledging that their pet has not eaten in the last 8 hours, any type of pre-anesthetic blood work that needs to be done, depending on age. They have our under 8 years of age and our over 8 years of age. A microchip if they would like one for their pet today, and the use of a laser. We use the laser in our hospital. They can choose if they would like that or not. And then it has also that we will be placing an IV catheter and monitoring any pain management and fluids and things like that. And then the owner does sign and give an emergency contact number. For our cage cards, we use their check-in sheets with their name and owner information as well. We just put it on a clipboard here with a blanket in the cage. When we go to send over his pre-anesthetic blood work in the morning for our in-house test, we will select his doctor and then which test we are running. We will be running the pre-anesthetic blood screening. We will go ahead and check it and hit create, and it will send it over to our in-house IDEX machines. If we were to send out a test to the lab for him, we would do it here with our reference lab request. We would select his doctor one more time, and then we would select which test we would be doing for him. We will do a young wellness test. We will order it here, and then a requisition will pop up here, and it has his name, information, our hospital's information, the details of the collection date, and which test we are requesting for IDEX to run. We will print this out and put it in the bag with his sample to send to the lab. These are our anesthesia monitoring sheets. We have on here our client name, patient name, chart number, what they're here for, the doctor, and the date. And whichever technician takes the surgery will initial it as well. We have on here their weight and their TPR. This section here will be any pre-anesthetic drugs that they will receive and their dose and the time it was given. Here is our induction drug. We use propofol here, and it is always given IV. We will look at their dose on their sheets. We will mark on here what type of anesthetic maintenance we will be using. We use isoflurane, and depending on the size of the patient, we will either use a circle or non-air breather. We will mark what type of ET tube we use. We will be giving them IV fluids at a surgical rate. Here's where we will do any medications, injections given. We have antibiotic, analgesia, and other. We will do either pre, intra, or post surgery. We will have the dose, the route, and the time given. This is for any emergency drugs given, and then we also have our anesthesia start times, surgery start times, and finish times. And in here we will mark all of our vitals every 5 minutes: heart rate, respiratory rate, oxygen level, ISO level, SpO2 percentage, blood pressure, and temperature. Here is our home care instructions for pets placed under general anesthesia. So Zach will be getting one of these today. It has on here some food and water instructions for the night after surgery and the next morning. It has some information about the incision, about it needs to be kept clean and dry for about 10 to 14 days following the surgery. It needs to be watched for any redness, swelling, or discharge. We give some recommendations for an e-collar, a t-shirt, or something to keep them away from their incision. We also talk about their IV catheter and that they will have a shave spot and to remove the bandage when they do get home. It also has any information here if they have sutures under the skin and they don't need to come in for a suture removal. It also has if they do have sutures that need to be removed, when to come in, and if they didn't have any sutures at all. We also have any take-home medications here, what they are and their strength, as long as with the instructions, when to start them, and then any emergency contact information here. Alright, so to hold for a jugular blood draw on a dog, what you want to do is have them in the sitting position. You want to make sure you lift up their collar so that it's not in the way, and you just kind of grab their muzzle. You can hold their sides with your knees and just go ahead and lift up her head. And so the jugular vein is available for the technician to come in and draw the blood. Alright, so we're holding for a cephalic blood draw. We're going to be holding them in sternal recumbency. I'm going to go ahead and hold her head so she can't bite me or the blood jar. I'm going to go ahead and extend her leg out. I'm just going to roll the vein off, and so the person can come in and draw her blood. Alright, so to hold for a lateral saphenous blood draw, I have her in lateral recumbency. I'm going to use the top leg here. To occlude the vein, I'm just going to go above the knee on both sides and squeeze, and then the blood drawer can come in and draw the blood from her saphenous vein. I'm going to be demonstrating how to place a pet into a cage. So what I'm going to do is go ahead and set her down in the cage. I'm going to keep my hand on her until I can get the cage safely shut. Alright, so I'm going to be demonstrating how to properly take an animal out of a cage. I'm going to go ahead and open it. I'm going first with my hand to make sure she doesn't jump. And I'm just going to make sure I lift from behind so I have her securely in my hands. Alright, so I'm going to properly place a muzzle on Penny today. I have one that is proper for her size. I have her standing between my legs because I don't want to come at her face with the muzzle. It might freak her out more. So what I'm going to do is come from behind, slide it over her nose, and go ahead and buckle it behind her ears. And then once it's buckled, you want to make sure it's good and snug so they can't get up off their ears. Okay, so today I'm going to be placing an e-collar on our girl here today. So she was spayed and we want to put an e-collar on her so she cannot look at her incision. So first I selected a size that would be right for her. She does have this shorter nose, so I didn't need one that was super long. But what I'm going to do is go ahead and pull it over her head, pull her ears out here, and then once it's on I can check to make sure that her nose doesn't go over the edge so she won't be getting around it to look at her incision. And then I just have a piece of brown gauze here, I'm going to tie it on. And I just want to make sure it's snug enough that it's not going to slide off her head, so I can still put my fingers underneath it. Alright, so I'm demonstrating how to do a physical exam today. This is Zoe. She's here to be spayed. She's going to go ahead and start off by performing my TPR. And so first things first is I'm going to take a rectal temperature. Alright, her rectal temperature is reading at 102 today. With that. Next I'll use my stethoscope to oscillate the heart and listen for her heart rate. As I'm listening, I'm also going to be listening to all different sides of her heart, making sure I don't hear any murmurs or arrhythmias, as well as listening to her lungs. Make sure I don't hear any cracking or wheezing. Everything sounds good there. Her heart rate was about 120 and her respiration is at 30. I'm going to go ahead and start at the front of her and look at her teeth. She does have about a grade 2 dental disease, some tartar but not much redness in her gums. She does have a very noticeable underbite. Eyes look clear. There is a little bit of goop coming. It looks like she does have some tear staining on this side. Moving on to her ears. Everything is looking clear. It doesn't look like she has any redness or debris down in there. Next, I'll just kind of fill, make sure I don't feel any enlarged lymph nodes as I'm coming down. Kind of switch here. Make sure everything is feeling good. Here, pause. She doesn't have like any overgrown toenails or anything. Kind of fill down. Make sure you feel for any bumps. Make sure she's not showing any pain in her abdomen. Come on down. Check out her back end. Make sure there's no masses or her anal glands look okay. Come on down to her back toes. Everything's okay there. On this side, she does have a detached dew cloth that is hanging on that the owner has requested we take that off today. Other than that, she's looking pretty good, and I give her an ASA score of 1 today. She's good for surgery. Hi, so I'm going to be doing a exam today on this kitty, Yamaha. He is in today for facial swelling, so we'll be looking at that. I'll start off with his TPR, so I'm going to start with his temperature. So I'm just have Katie hold him for me. Turn it in. I'm sorry, buddy.
No, we're done, Yama.
And just waiting for it to beep. His temperature is at 99.9. So go ahead and throw away the cover for the thermometer. Alright, next I'm going to use my stethoscope to go ahead and listen to his heart and lungs, as well as get a count of his respiration and his heart rate. So I'll go ahead and listen on the left side first. I'm going to go ahead and count for 6 seconds. Alright, and while I'm listening, I'm going to go ahead and listen to his heart, make sure I'm not hearing any murmurs or arrhythmias. I'll also go ahead and listen to his lungs. Make sure I don't hear any cracking or wheezing. He has purring. His heart rate was about 220 and his respiration was at 50 today. All right, I'm going to go ahead and start my exam. Start up here at his face. I'm going to go ahead and look here. He has some facial swelling. Go ahead and look in his mouth. He does have pretty severe dental disease, probably a stage 3-4 on both sides. His eyes do look clear. He is a very old boy, so they are kind of cloudy and blue. Let's see here, his ears looking clear. There's not any debris or wax buildup down in that one. This one does have a little wax buildup. Go ahead and fill to see if I feel any swollen lymph nodes down around. Check his legs, make sure there's no broken nails. Make sure I don't feel any lumps or bumps. Kind of feel his abdomen, make sure I don't feel any masses or anything in there, if there's any pain involved. He does have some muscle wasting along his back, but like I said, he is a very old kitty. His back feet are all looking good. Doesn't look like he has overly filled anal glands or anything like that. Overall, he's looking okay. I do know he does have some pretty severe thyroid disease, and so today I'd give him an ASA score of 3, and anesthesia recommendations would probably be kind of a risk over benefit for Yamaha today. Alright, so I'm going to do a cephalic blood draw on this dog here. So I'm going to go ahead and apply some alcohol, pull up the vein. I'm going to go bubble up. So I'm going to go ahead and insert into the vein.
Okay,
And pull my
I'm going
sample.
to the next room, so just listen.
Alright, so I'm going to be doing a jugular blood draw on Maximus here today. So what I'm going to do first is I'm going to go ahead and find his thoracic inlet, apply pressure, and go ahead and see if I can feel where his vein is. Once I've found the vein, I'm going to apply some alcohol. And with my syringe, it's going to be bubble up. I'm going to insert it about a 45-degree angle and pull back. And once I have blood, I'll just slowly pull back until I have my desired amount, and go ahead and hold off. Alright, so I'm going to be drawing blood from the saphenous vein on this dog here today. So he's in lateral recumbency and she's holding off just above the knee there. Just going to apply some alcohol, and I can see the vein there. So I'm going to go with my bubble up. Just going to go ahead and insert it into the vein.
You're right, Scout.
And go ahead and pull back. That's good. Doing a cephalic blood draw on Tigger today. So I have my alcohol, and I shaved a little spot here on his leg. And apply the alcohol. With my syringe, I'm going to be bubble up. Go ahead and insert it into his leg. And I do have blood, so I'm going to go ahead and slowly pull back to get my sample. You can go ahead and stop. Alright, so I'm going to be drawing some blood from the cat jug today. So first things first is I'm going to go ahead and find the thoracic inlet. And going to go ahead and see if I can fill the vein. And once I can fill it, I'm just going to go ahead and apply some alcohol. And then once I fill it again, a little bit more alcohol. I'm going to go bevel out. I'm going to go into the skin. And once I have the blood entering the syringe, I just slowly pull back to go ahead and fill my syringe. And that's like a video. Alright, so I'm going to be drawing blood from the medial saphenous on this kitty today. So she's holding out the vein there, and you can kind of see it there. I'm going to add some alcohol so I can visually see the vein. I have my butterfly catheter here. I'm going to go in with the bevel up. And go ahead and insert it into his vein right. Now that I have the blood coming into the butterfly catheter here, I'm just going to slowly pull back on my syringe to draw the sample. Hi, so I'm going to be talking about diagnostics today. I'm going to start off by talking about the minimal databases that are required for a surgical procedure. The first being the PCV, or the packed cell volume. It's checking the percentage of red blood cells within the blood. You use that by doing the hematocrit tube and spinning it down to read what the plasma levels. Next up is the total protein, checking out the plasma protein levels. You check this with a reflectometer. Next up, you would be checking the blood glucose levels to be checking for function of the pancreas to make sure everything is good there. And next, you would be looking at the kidneys with the BUN, checking to make sure the kidney is functioning correctly to go under anesthesia. And last is the ALT, which is a liver value. You are checking that to make sure the liver is functioning properly and everything is good to go under anesthesia. Blood glucose can be ran a couple different ways. You can do it with a glucometer, or you could run it with plasma in your catalyst. You can also run the ALT and BUN with plasma in the catalyst as well. So those are the minimal databases for a surgical procedure. In my hospital, we do a little bit extra with our pre-anesthetics. We will also run a CBC and a full chemistry panel. So we are checking to make sure that the platelets and white blood cells, red blood cells, everything is looking good to go under anesthesia to make sure there's not any underlying infections. As well as a full chemistry panel, we're checking for any abnormalities there that would make it unsafe for the patient to go under anesthesia. If we do have a patient come in and under physical examination, it does present with a heart murmur, we will continue with some chest films and a blood pressure as well as ECG, or we will do an echocardiogram and send him off to the cardiologist to make sure our patient is safe to go under anesthesia for a procedure. If we have a patient coming in with vomiting, diarrhea, depending on the age of the patient, if it is a puppy, first things first, we are going to run a parvo test to make sure that is not the issue of the illness. An older vaccinated animal, we will go into a fecal test to make sure that there is no internal parasites, as well as running some blood work to make sure there's not any type of infection or toxicity that's causing issues within the body, as well as performing some abdominal x-rays to make sure there's no foreign body. If that kind of rules everything out, we also will sometimes run a urinalysis to make sure there's no UTI involved, as well as if we have a sick kitten come in, first things first, we will run an FELV FFV test and continue on from there. Alright, so we're talking about some anesthetic protocol today. In my clinic we have these pre-calculated drug sheets. You just enter in the patient's weight, name, and age, and it calculates based on the drugs we have here. So this is our dog one. Typically what we'll do is any dog that's under around 7 or 8 years old, we will give a dose of Torb with ACE and some atropine to contradict the ACE, lowering the heart rate. Before surgery, we will usually give them an NSAID. If they're above 25 pounds, they will get Rimadyl. Below 25 pounds, they will get Metacam. Post-op, depending on the severity of the procedure, smaller dogs and smaller procedures will get buprenorphine. Some bigger dogs and more intensive surgeries will get hydromorphone post-op. For our older dogs above 7 or 8, we usually will just start with a Torb and midazolam pre-med, followed by the same NSAID and post-op pain medication. We will induce with propofol via IV catheter and intubate and maintain on ISO. For our kitties, our younger cats, same kind of thing, under about 10 years old, we will do the DKT Kitty Magic, so dexdomitor, Torb, and ketamine. We will do Metacam and buprenorphine post-op, induce with propofol and maintain with isoflurane. Our older kitties, we will do a Torb midazolam lighter sedation as well, and that is it. I'm going to be making an entry into our controlled substance log. The drug I'm going to be logging is midazolam, and our patient is for Noodle. So I'm going to go ahead and add today's date, which is 10/19/23. I will add the patient's name, Noodle, and his last name is Folk. K9. Tech or doctor initials, it was me, so I put my initials. The amount that is remaining in the bottle is 8.8. We took out 0.75, and so do the math. It's 8.8 minus 0.75 is 8.08 or 5. Okay, so we're going to be going over the parts of the anesthetic machine today. We'll just kind of start at the beginning and work our way through. So first we have the oxygen. It comes in through the through the oxygen system from outside, from our H tanks, and comes into the machine here. We have our pressure gauge in the back to show us the amount of oxygen coming into our machine. On our machines, we do have E-tanks in case of an emergency if our oxygen system seems to not be working or we're out of our H tanks. It comes on in through the flow meter here. This controls the amount of oxygen that's being given to the patient per liter to the patient. Next, we have our oxygen flush, which will just bypass the flow meter and the vaporizer and go straight to the patient. And then we have our manometer here that shows the pressure of oxygen getting to the patient as well. Next, after it leaves the flow meter, it's going to come into the vaporizer, which holds the anesthetic gas. We use isoflurane. You can see the level of your isoflurane here, and to fill it, you unscrew this lid here and pour on your isoflurane until you can see that it is to this white line here. To turn on the vaporizer, you do push down this black lever here and turn it to whatever percentage of gas you want to give your patient. This will not dispense any gas unless the oxygen flow meter is on and creating the flow. So as oxygen comes in, it mixes with the vaporized gas, and then it comes out this outlet valve here and into the patient. And right now we have our rebreathing system hooked up, and it's going to come out the inhalation flutter valve. It's going to open as the patient takes a breath. The gas is going to come up the center of the tube and into the patient, and as the patient exhales, it's going to come out of the tube here, and the carbon monoxide and gas is going to be absorbed into the carbon line and then into our reservoir bag here, which a portion of the gas is then going to be rebreathed in by the patient. And as it leaves out the scavenging system and out into the exhaust system. This is the pop-off valve. It is important that this is always open. If it is closed, the air cannot leave the patient and they will not be able to exhale. And so there's that system there. Next is the non-rebreathing system. It hooks up just slightly differently. You go directly with the oxygen there, to that tube, and then the exhaust system connects right to the bag here. And this system, it goes in the patient and straight out. They do not rebreathe any portion of the gas. All right, go ahead and put this back on to our rebreathing system. That way we can do a pressure check on our anesthetic machine. To go ahead and do a pressure check, what we're going to do is check to make sure that there's no leaking of any of the oxygen or gas in our machine to make sure everything's working correctly. To do that, you're going to go ahead and close the pop-off valve here, so that way nothing can come out. You're going to go ahead and turn on your oxygen here and let your reservoir bag fill. And once it fills, you want to make sure that it's gaining pressure and not losing. And then you're good to go. Turn off your oxygen, and most importantly, you're going to reopen your pop-off valve. You never want to leave it closed here. And then we have a couple different ways, things that we can hook up to our anesthetic machines for maintaining anesthesia or getting animals under anesthesia. We have our masks. We have large or small, depending on the size of the patient. It's easy, you just put it on the end of your thing over the nose of the patient, and we use that for small animals that we can't intubate, or if we're just doing a mild sedation where we just need to deliver some oxygen and maybe a small amount of gas. Our induction chamber here we use for our patients that are fractious and we're unable to handle safely. So we just go ahead and place them in here, and then it has an in and an out hole here. So for the gas and the oxygen, it's going to be on that side, and then we connect it directly with our exhaust system, and so there's not a buildup of CO2 in the box with the patient. And then once they are safely under anesthesia, we get them out as best we can and get the box out of the hospital to try to reduce the amount of ISO that we breathe in ourselves. Alright, and then that is the anesthetic machine. Alright, for our exhaust system, it's just turned on by the switch here. You just turn it on, and with the lights on, you know your exhaust system is working. Alright, so our oxygen tanks are outside of the building in their own room. These are our H tanks. They are kept in the upright position and they are chained in. We have a little tag for which one we are using, and then I have an extra reserve tank. To go ahead and switch them, I would close one off and then open up the other one, and I would check here on my meters to make sure that the tank is full. Let's see, this tank is measuring full at about 1200 psi. This tank is getting closer to being empty. It is right now at about 50 psi. Alright, I'm going to be placing this esophageal ECG, and it also reads her temperature. So what I want to do is measure it to be right next to her heart. And to place it, I'm just going to go in to the side of my ET2. Get right down to where I measured. And then I look to the screen to see my ECG coming across the bottom, as well as starting to read her temperature and see it going up. It looks like our SPO. Alright, so I'm going to be placing a cephalic catheter on noodle here. So first I'm going to prep the site by shaving. Get rid of all the hair. So for my scrub, I'm going to be using my Chlorhex scrub followed by an alcohol wipe. I'm just going to go ahead and scrub the out of the site, followed by alcohol. And I'm going to be doing this 3 times. With alcohol. And then final alcohol wipe. Alright. I'll take my gloves off to place the catheter. Alright. Let's see, go ahead and roll. I think I'm going to go with the 20 gauge catheter. I'm going to bevel up. And I'm going to insert into the vein. Alright, now that I can see that I have blood coming into the stylet, I'm going to go ahead and advance. Katie's going to hold it for me. This is my preceptor, Katie, who has been helping me with my video this semester. And so now that my catheter is in place, I'm going to go ahead and anchor it in with some tape. Okay.
We don't really do these ones on that one.
Like that.
Okay, so yeah, so the vein will be right here above the monitor. Yeah, right here. I'm just sitting here. And then she'll hold off this.
And last, I will anchor it in with a little small piece of tape here. And then I will get some bed wrap right here and cover it up.
You can use this.
I also have some saline here that I'm going to flush the patency of my catheter. I'll do that before the bed wrap. Looks good. I'll go ahead and finish with the bed wrap. Cover of my catheter. That's it. Okay, so we're going to be doing the catheter on the softness vein today. So first I'm going to go ahead and shave my spot. And I'm going to place the catheter. so first I'm going to do my scrub. I got my the Chlorhex scrub with followed by alcohol scrub. So I'm going to do 3 of each. Last Chlorhex scrub. And then last. Alright. Now that my scrubs are done, I'm going to take my gloves off. Get all my supplies ready. I'm going to use the 18 gauge catheter. Alright, I'm going to go with my bevel up. I'm going to go ahead and insert it into his back leg. And you see the blood coming into my stylet. I'm going to go ahead and advance the catheter. Make sure I have blood flow there. Lexus and then hold it for me. I insert the port. I'll go ahead and anchor it on in. Alright, I'll do one final anchor here. Alright, we'll go ahead and check the catheter. Make sure we're good. Some saline. Catheter is good, and so I'll go ahead and finish the catheter by covering it with a little bit of wrap. And there's our softness catheter. Go. Alright, so I'm going to be doing an IM injection today for Frankie's pre-med for his surgery. So I'm going to do it here in the back. So I'm going to go ahead and hold the muscle, make sure I can feel it good. I'm going to insert my needle, pull back a little bit, make sure I'm not going to have any blood in there, and then pull straight out. Alright, so I'm going to be giving Frankie his sub-Q injection today. So I got some Medicam. To go ahead and give a sub-Q injection, I'm just going to pull up the skin, make sure I have a nice tent, go in, pull back to make sure there's no blood or anything. Alright, so we're going to be doing an IV injection today. So I have my medication here. I'm just going to be getting some IV sedation for a little procedure today. So I'm going to go ahead and wet down her vein. I'm going to go bevel up and insert into her leg. And I pulled back and I have a flash of blood, so my holder's going to go ahead and release. I'm going to slowly give the injection. I'm going to pull back just a little bit, make sure I'm still in the vein. And there we go. Alright, so I'm going to be inducing anesthesia today and intubating Lucky here for his dental cleaning. So I have his IV catheter placed. I listened to his heart to make sure it is over 100 to be able to induce anesthesia. I have propofol here. I'm going to slowly inject the propofol. You don't want to do propofol too quickly. It will suppress the respiratory system and it will stop breathing. So I'm going to go ahead and start. I'm just going to go ahead and do a little bit here. Just give them a few seconds and then I'll go ahead and inject some more. Propofol. Starting to kind of feel the effects. He's getting a little more sleepy. After a few seconds, I'll go ahead and inject a little bit more propofol. And then I've selected an ET tube that is appropriate for his size. I have measured about the depth that I would like it to go in. Alright, now that I feel like he's in a good place to intubate, I'm going to go ahead and use my light. I'm going to go ahead and use the tube to pull out his tongue. Hold it here. And I'm going to visualize soft palate. trachea. I'm going to place the tube. Alright, and I can see that there is fogging, so that's a good sign that I am in the trachea. Tie in my tube. And then I'm going to go ahead and hook him up to the non-rebreather, turn on my oxygen and my ISO. I'm going to inflate the ET2. Alright, and at this point, I'm going to apply some eye lube for Lucky.
For me, it's totally awesome.
And at this point, I can see that the tube is fogging when he takes a breath. I'm going to kind of listen and look, and kind of smell to see if I can hear any air coming around the tube to make sure that it is, secure in place and is the right size for him. And at this point, I think he's in a safe enough place under anesthesia to go ahead and start his dental cleaning. After completing an intubation of an animal, you are going to be inflating the cuff. And to properly inflate it, you want to inflate it with a syringe until it is equivalent to a soft pillow. You don't want it overinflated because it will be causing pressure and irritation in the trachea. You don't want it underinflated because the gas will be able to leak around it, and also liquid will be able to get down into the lungs, which is not good. A good way to check it is the listening for any air coming around it, or if you can actually smell the gas coming around it when they take a breath. S'more's all ready for her spray today. We're going to go ahead and express her bladder. So I'm going to go ahead and fill on her abdomen here, where I can feel where the bladder's at, and I'm going to gently squeeze it until the urine comes out and drains her bladder. Perfect, that's all you gotta do. Alright, I'm going to go ahead and prep Dolly for her spay today. So for shaving, I'm going to go ahead and shave her abdomen. I'm going to start right here, edge of the ribs, all the way down.
Okay, so for our drop off,
Try to make it as even as possible.
Alright, so for Coda, has a big hole in its neck. So we need to flush and clean it with some betadine. We need a basal injection and 2 medications to go home. We're going to spin that mass out for official pathology. So we got to get the 2 pieces in there, one large one and a little piece. We'll turn both in a 20 yard and then we'll drop it.
And then once I have all the hair off, I will use the vacuum
the soap. So how much
to go ahead and get all the loose hair off of her. Next will be the scrub.
Go.
Alright, so I'm going to be preparing Dolly for her surgical scrub today. I'm going to start in the middle where the incision is going to be made, and I'm going to go ahead and circle away from the surgical site. I will repeat that with an alcohol scrub. And then repeat that 3 times for as much contact time as possible.
Under the third eyelid.
Alright.
Sometimes you'll get a little film, and as they delete that film, that goes away. Which means
My final thorax scrub.
It has not defecated in 3 days and strained.
And the last alcohol scrub.
So question.
Alright, next up we'll be moving her into surgery. Alright, so we're getting ready to move into surgery. So first things first, I'm going to turn off the gas and the oxygen. And hook my patient. Use this towel. Support his head. he's in surgery, we're gonna go ahead and hook up his tube again. Turn on oxygen and his gas. We're gonna be securing his legs down. Noodle is getting a cystotomy today, so he does have a urinary catheter placed. Tie his front legs forward. And on this side. When he's secured down onto the table, we'll go ahead and start hooking up our monitoring equipment. First up, we have our SpO2 monitor. It just goes ahead and clips onto his tongue. And then next we have our ECG lines. We have 3 here. We have our left side here that we go smoke over fire. And then on the side we have our white. And we're just gonna go ahead and add some saline or alcohol to it. Saline. And next up is our temperature probe. We do it down the esophagus. I'm just gonna go ahead and place it down in there. Next we will hook up the blood pressure cuff. So go ahead and do that. We are going to connect it. Go ahead and place it on his leg here. Connect it there. And then you can see here that all the monitoring equipment is going. The ECG is down here. We have our SpO2, and then our blood pressure is reading there as his temperature is there. We do not have a CO2 monitor, but if we did have one, it would give our number here, and it would attach between the rebreathing tube and the ET tube. That's it. Alright, so I've been here monitoring today during Dell's endoscopy procedure. So I'm going to go ahead and take a reading. It is 240. His heart rate is currently at 110. His respiratory rate, I was going to manually count it with him today. And then about 20. His oxygen level is at 2. His isotope percentage is at 1.5. His blood pressure is at 101, and his temperature is 99.3, and his SpO2 is reading at 98%. And in 5 minutes, we'll go ahead and take another reading. All right, so today I'm going to be demonstrating how to perform CPR. Screech is obviously alive and a good boy, but he's going to be our model for today. So when a dog is needing CPR, what you want to do is you want to find kind of where their heart would be. It's usually like where the elbow is there on the chest. You're going to interlock your fingers like this and go right over where the heart is. And you want to do stiff arms, and you're going to do hard compressions. You're going to do 30 compressions. And then if the dog is intubated and you have your bag, you will give 2 breaths. And then you will continue with 30 more compressions. I'm simply demonstrating a scrub and gown and glove. First, I'm going to go ahead and wash my hands really good with soap. Make sure there's nothing under my fingernails. Give it a really good scrub with soap. And then I will be using the Avogard scrub or dry scrub for my scrub today. So I'm gonna do this. I'm going here to surgery where I'll start my scrub. So we have our 3M Avogard here. First I will do my right hand. So I'm gonna go ahead and start with my fingers and then move on down to just below the elbow. And then I will go ahead and do my left hand, starting at the fingers and then moving down my arm, like so. And then I'll do my final pump for my hands. Then I'm gonna allow this to dry. You don't want to use towels because contact time is important, so it's just drying motion. All right, now that my hands are all dried from the Avogard, I'm going to go ahead and put my gown on. I want to not let it touch anything. Put my arms in. Tie me in. Now that I'm in, I'm going to go ahead and get my gloves opened up. Alright, so I've got my right glove here. So I'm going to go ahead and get my hairs in here. Alright, so now that I have it on my hand where it's supposed to be, I'm going to go ahead and reach with this side of my hand and pull it on. And as I pull it down, my hand will come out of the sleeve and into the glove. Okay. And then I'll repeat the same thing with this side. Here. On. Go ahead and pull them up. And then to remain sterile, I'm going to keep my hands right here. I'm not going to put them down or anything. That way I can be a sterile participant. And to keep sterility, I'm going to make sure I am always touching in the sterile field. I'm not touching anything out. If something was to happen and an instrument be dropped, it's to stay on the floor. I won't reach down to grab it or anything. We'll get a new pre-wrapped one, or we will have our unsterile participant go and do a flash sterilization. If something was to happen to my glove or gown, it does need to be changed immediately. The unsterile assistant would come in, remove your gloves if it is just your gloves, and place new gloves on. Or if it is your gown and your gloves, you will just take everything off and start over. Alright, so I'm getting ready to assist Dr. William with our spay today. So first things first is I'm going to open up our surgical pack, get all of our instruments ready. We use the laser in our hospital, so we have our laser handle and we have our scalpel blade. First things first is I'm going to get my scalpel handle here, and then I have my blade. I use my needle driver here to help guide it on there. Once it's on, I'm just going to set it over to the side so that it is not in our way. We have our drapes here. Open this up to place it on our patient. on her. And then Dr. G can come in here and he can pick where he wants to cut the hole for the surgery, and I will hand him his towel clamps once he is ready. In our hospital, we do use the laser, so he will be using that to cut through the first layer of skin, and then we will go ahead and hand him the scalpel. As a surgical assistant, it's my job to maintain hemostasis, and to do so, you never want to rub the tissue. You just want to dab like so that the blood is out of the way. Another job as a surgical assistant is to maintain the moisture of the tissue, and I have some sterile saline in my bowl here, and I'm just going to go ahead and squeeze them in to keep everything nice. Perfect. Alright, so we have June here. She's about to be spayed. Just kind of go over some things that we're going to be monitoring while she's under anesthesia. So every 5 minutes we are going to be taking her vitals. So at 10:05 her heart rate is at 106. Her respiratory rate is about 70 right now. Her oxygen level is set at 2 liters. Her ISO is at 2.5%. Her SpO2 is reading at 99%. Her blood pressure right now is at 129/108. We just record the systolic, so 129. And her temperature is currently at 100.4. And in 5 more minutes, we will take another set of vitals. Yep. Alright, so we're getting ready to go ahead and neuter this cat. We have him all scrubbed up, and Dr. William is about ready to start his procedure. Go. Alright, so we have Scout here in his neuter today. Dr. Robson's just about to come in and get started. I'm just going to be doing some monitoring. So far we have recorded what we've given him for his pre-med, what we induced him with propofol, and his analgesic that he had, his Medicam, and he'll get buprenorphine after surgery. Alright, so I'm doing some post-surgical cleanup today. So we use the laser in our hospital, so I'm going to go ahead and lock that in there and remove this laser tip. Go ahead and cover it up to protect it. Alright, and then I come over here to the surgery pack that the doctor used, and he did leave his blade on his scalpel handle. So to go ahead and properly remove that, we're going to use our needle drivers to go ahead and safely remove it off of the scalpel handle. And then I'll place it into the sharps container. It doesn't look like there's any other sharps on here, but what we will go ahead and do is remove any of the garbage off of the pack. And then it looks like there's no other sharps on here, so we'll go ahead and take this out to be washed. Okay, one. In between surgeries, we just kind of go ahead and make sure everything is organized on here so the wires aren't getting tangled. Get ready for the next patient. We will go ahead and replace the towel over our water blanket. And we'll put that in our laundry. We'll go ahead and turn off the lights. There we go. And then we will come on over to our anesthetic machine, where we will kind of clean some stuff here. Go ahead and take off our non-rebreather. Just kind of straighten. There is a needle here, so I'm going to go ahead and put that into the sharps container. just to make sure there's not anything extra here, we'll use our little disinfectant wipe to wipe everything down. And then just make sure everything is ready and in the right place for the next surgical procedure. All right, that's it.
Yeah.
And at the end of the surgical procedure, to go ahead and get rid of any of the biohazard waste and everything we use, we'll go ahead and take out our trash and take it out and dispose of it. Alright, so I'm getting ready to go ahead and wash up my surgical instruments from our surgery today. First I'm just going to I have my pre-filled chlorhexidine soap bath here. I'm just going to go ahead and place all the instruments in there, making sure that there's no leftover sharps or anything on the instruments. I'm gonna go ahead and let them soak in there, loosen up any blood or anything that's on them. And once they have soaked, I'll just take them out one at a time. First, I will do a scrub with the hinges closed, make sure there's no loose blood anywhere. I'll make sure I open and scrub the inside of all the hinges. And the tech appointment. And I'll just make sure I do that on all the instruments. Make sure there's no loose debris or blood left on them. I'm just using a soft bristle toothbrush for this, not so I don't scratch the metal. And then I'm just placing it into a water bath here to rinse off all the excess soap. And once I do the initial scrub, this is where we'd place it into an ultrasonic cleaner. We don't have one here, but this is the stuff we would to get all those little tiny stuff off. Next, we do have our instrument bath. What we'll do is we'll go ahead and anything with the hinges, we will place into our bath and let it soak. So to go ahead and get everything all lubricated and protected. All right, so today I'm going to be wrapping up my surgical pack. My hospital's surgical pack recipe is right here. We have all of our different instruments that we keep in our standard surgical pack with our gauzes and our drape. So I have everything on my pack here. So what I will do is I will go ahead and place the 15 gauze evenly across. I'll do my sterile strip paperwork here. And on top of that, I will place my paper drape, disposable paper drape for surgery. Go ahead and wrap the towel over the instruments. My first layer, I have my sterilization paper. Just gonna go ahead and do my wrap. I'm gonna make sure that my corners are always facing out for easy sterile opening. And then for my final, be a tuck under here with my corner tab out. And then we will double wrap our surgery pack with a cloth drape. Go ahead and put that out. Center. And then I will just do the same thing. These ones are a little bigger, so sometimes you gotta do a little bit of accordion fold. And it's important to get it as tight and as neat as you can. Alright, so there is my pack wrapped. And then I'll get my sterilization tape here and go ahead and label my pack. And then I'll use a black marker to write, this is our surgery pack. It was wrapped on 10/2/23 and my initials of CL, and is ready to go in the autoclave. All right, so today I'm going to be folding and wrapping our surgical gown. So first I'm just going to go ahead and find the corners, make sure the arms are right side out. I'm going to go corner to corner. And sleeves here. And lay it down. Make sure my seams are lined up. Make sure all strings are out. And do a half fold here. Make sure my arms are in there good. Everything over, strings out. And then this is where I do my accordion fold from. Start at the bottom. And wrap all these strings in. I'm going to go ahead and look at the size of my gown to make sure I label it correctly. This one is a large. And I make sure the strings are at the top, easy for the doctor to grab. And then I have my cloth drape here. I'm going to go ahead and put the strings on the middle. Next will be my sterilization strip, and then a towel for hand drying. And then I'll just go ahead and wrap, pack, the gown. Keep everything neat, make sure corners are out. A nice tight wrap. And use my sterilization tape. And I will label it as a large gown, wrapped 10/2 of 23. My initials of CL, and that's ready for the autoclave. So how an autoclave works, it uses steamed pressure to sterilize and disinfect anything that's inside of it. All right, now I have my packs here ready to be put into the autoclave. So put that one lower. I'm going to go ahead and place my packs into the autoclave. I also have some pouches that I'm going to place in this bottom tray. You do not want to overfill your autoclave, so as long as everything is in there, but it's not, too smushed or touching the sides, everything should sterilize properly. Make sure I have enough distilled water in there. Go ahead and shut the autoclave here. And to start it, you will pick through your settings. I'm going to do the pack/pouch setting. It is going to go ahead and start, and there we go. And then for proper sterilization, the packs need to be run at 250 degrees Fahrenheit at PSI of 17 for 30 minutes. All right, so we're talking about some autoclave maintenance. So on a daily basis with your autoclave, you want to make sure you clean all exterior surfaces. Make sure there's no dust buildup on your machine anywhere. On a weekly basis, what you want to do is go ahead and remove the hose, drain it into a bucket, and then once that's all drained out, maybe take out your trays and your rack here, and you clean it off really good with a rag and some of this all-purpose cleaner for the sterilizer. Once it's all clean and wiped down and dried, you just will replace everything and refill it with some sterile water. On a monthly level, it's a little bit more included. You'll do all the same thing where you remove everything, you drain it, and then you fill it back up with some distilled water, and you add in some cleaner directly in the bottom of your autoclave. You will run it on the pouch setting, and before it dries, you will go ahead and stop it, drain the water out again, refill it again, do the pouch setting one more time to go ahead and rinse the autoclave, and then you refill it again, empty it and refill it with clean distilled water. You also would remove the gasket here and clean it really well, and that's your maintenance for your autoclave. Our autoclave is all finished. We're going to go ahead and pull out our packs to see if they sterilize correctly. And then we got our gown pack here, and you can see that the tape now has these black lines across it, and that means that it's sterilized correctly. Alright, so today I'm going to be removing some sutures. I got my suture scissors and some thumb forceps to go ahead and take them out. First, what we're going to do, if you want to get a little closer, is we're going to look at the incision, make sure everything's held up good. It doesn't look like there's any redness around the incision or anything like that. Things that would look bad if we didn't want to take out the sutures today would the incision would be red, you would probably have some discharge, it would just not look so good. So to go ahead and take out the sutures, what we're going to do is go ahead and pull up here on this, get under the suture, and then you'll just kind of do that down throughout, and go ahead and take out the sutures. And his looked like it's healed up good, so we don't have any issues go ahead and taking them out today.